in January of 2020. I was in Miami. I was taking a mini vacation, and I had a club operator call me and tell me that the mayor needed to shut the city down. He had found out some information about the coronavirus that was spreading rapidly through other countries, and it was headed to the US. Exactly what he was saying was coming, it ended up happening less than 60 days later. I remember vividly being called to the Emergency Operations Center and sitting in a room full of cabinet members with no mask on and talking about the coronavirus and what the impacts were and what the risks were and whether or not it was important for us to shut down at the time.
We very quickly mobilized the city to be able to respond to the pandemic. And this was not a pandemic like we had seen before. We had some experience with H1N1 in 2009, but we had never seen quite this happening in the city and around the world. We made it easy here in DC to make sure that individuals didn't have to go see their doctor for testing. We wanted to make it quick and convenient. We wanted to also make sure that there was no charge for testing. That was very important. And that allows us to have a better picture of what's going on in the community, not just one part of the city or one demographic. It allows us to understand at large what is going on. And then from there, we tailor interventions based on what we're seeing in certain communities throughout DC.
And although we've had a number of protests and marches and rallies over the past year, testing has always been available. We've tried to make it as accessible as possible. We have held block parties and different types of social gathering functions where incentives have been provided. We were just trying to get people tested and provide education and outreach to different parts of the district to ensure that people were aware of how important testing was.
So we take that testing data, we combine it with our contact tracing efforts, and then we're able to use all of that data to have a better picture of what's going on in the city so that we can be able to respond more effectively. We were able to mobilize on-demand testing in communities where we needed more data. And so rather than having to walk 4 or 5 blocks, we put it, right next door to those communities.
When it comes to the data of testing, we were able to focus and identify pockets of the city that had a lot of community spread. We would knock on doors, we'd canvass, we would set up mobile testing facilities at an area rec center or facility in the neighborhood.
It's one thing for the Department of Public Health to stand up and go into communities, but it's another thing to have your peers, people that look like you, people that understand you, that are actually talking about COVID. And so we partnered with community-based organizations to make sure that it wasn't just a bunch of talking heads on television, but it was actually individuals that you knew and trusted from your community, talking about things like testing, the reason why it was important to quarantine, talking about our Stay DC program where it provided rental assistance to keep people in their houses.
Data and science drove us to be able to get to a point where we are now, and it continues to drive the District of Columbia and will continue to be, I think, for years to come.
We've learned a lot from the pandemic. We've learned how that we can be more mobile and agile and meet communities where they're at. And so we've taken that and actually written a report regarding of what the healthcare will look like moving forward. How do we make sure that we're making access available deep into the communities and not just focusing on COVID, but also since we're there, how do we continue to provide outreach to the community about their health at large?